Welcome to Golden Years Wisdom Channel, where we bring you essential insights for a fulfilling senior life. Today, we're exploring an important truth that many overlook. While staying active is vital for health, walking, often considered the safest exercise, can actually be harmful for certain seniors. We value your experiences and wisdom, so please subscribe, hit the like button, and share your thoughts in the comments below. Your engagement helps our community grow stronger, and together we can support each other through life's golden chapter. Now, let's discover when walking might not be the best activity choice and what alternatives can keep you safely active. Chapter 1. Blood pressure fluctuations, the hidden risk. When every step changes your pressure. For many seniors, sudden blood pressure changes during physical activity can create dangerous situations that develop without warning. Conditions like orthostatic hypotension can cause dizziness, blurred vision, and fainting spells that transform a simple walk into a hazardous activity, potentially leading to serious falls and injuries. Consider Julia, age 78, who ignored occasional lightheadedness until a morning walk ended with a sudden blackout and fractured elbow. Her doctor discovered her blood pressure dropped dramatically when active, requiring a modified exercise plan with shorter walks, proper hydration, and sometimes a supportive walking aid. By recognizing this condition and making appropriate adjustments, Julia continues staying active without risking her safety. Chapter 2. Heart conditions, knowing your limits. When your heart speaks, listen. For seniors with chronic heart conditions like heart failure or unstable angina, the cardiovascular strain from extended walking can trigger serious events that appear without warning. Your heart works harder with every step, and ignoring early warning signs, shortness of breath, chest discomfort, unusual fatigue, can lead to potentially life-threatening complications. Thomas, at 83, had been managing heart disease for years, but noticed increasing exhaustion during his daily walks. Instead of reducing his activity, he pushed himself further until chest pain and dizziness led to an emergency hospital visit. His cardiologist explained that his heart couldn't efficiently handle the stress and developed a personalized exercise plan with brief, gentle walks and seated activities. By respecting his body's signals rather than fighting them, Thomas maintained his cardiovascular health without dangerous overexertion. Chapter 3. Post-surgery recovery. Patience brings progress. Healing takes time, not miles. Recovering from surgery or injury requires appropriate movement, but excessive walking too soon can reverse healing progress and create new complications. Every step places demands on your healing body, and rushing recovery often leads to inflammation, instability, and setbacks that could extend your rehabilitation by months. Patricia, 72, underwent knee replacement and eagerly pushed herself beyond her doctor's recommendations, believing more walking would speed her recovery. Soon, intense pain and swelling appeared, and her follow-up appointment revealed she had strained the healing tissues, adding weeks to her recovery timeline. When she finally followed her prescribed gradual walking plan with proper rest periods, her knee healed properly, and she regained full mobility without complications. Chapter 4. Peripheral neuropathy, when you can't feel the danger protection. When sensation fails. Peripheral neuropathy affects many seniors, causing numbness and tingling that makes walking potentially hazardous when you cannot properly feel the ground beneath you. The greatest danger lies in the inability to detect injuries, blisters, cuts, twisted ankles, that worsen as you continue walking, potentially leading to serious infections or chronic wounds. Harold, 81, with diabetic neuropathy, enjoyed neighborhood walks until discovering a deep wound on his foot that he hadn't felt developing. Because he couldn't sense pain, he had walked for miles on an injury that eventually required extensive medical intervention and temporary mobility loss. His healthcare team helped him develop safer alternatives, stationary exercises, swimming, and seated workouts, along with proper footwear and daily foot inspections to maintain activity while protecting his health. Chapter 5. Severe arthritis, when motion becomes abrasion, gentler ways to stay mobile. For seniors with advanced arthritis, The belief that pushing through joint pain during walking will eventually bring relief often leads to accelerated deterioration and increased suffering. When protective cartilage has worn away, each step creates painful bone-on-bone friction that inflames joints and potentially causes permanent damage to knees, hips, and ankles. Martha, 75, continued her daily walks despite worsening arthritic knee pain, believing persistence would strengthen her joints. Unfortunately, her determination led to severe swelling, decreased mobility, and eventually difficulty with basic movements like standing from a seated position. Her rheumatologist helped her transition to water exercises and gentle cycling that strengthened surrounding muscles without painful joint compression, resulting in improved function and significantly less pain within weeks. Chapter 6. Safer Alternatives. Movement without harm. Finding your perfect activity. Match. When walking presents health risks, numerous alternative activities can provide similar benefits without the dangers. Water exercises offer exceptional full-body workouts with minimal joint impact, while seated strength training can improve muscle tone, balance, and coordination without stressing fragile systems. Chair yoga combines gentle stretching with mindfulness practices that improve flexibility, reduce stress, and enhance breathing capacity without cardiovascular strain or fall risks. Many seniors discover these alternatives actually provide more comprehensive benefits than walking alone, addressing multiple aspects of health simultaneously, while respecting individual limitations. Remember that staying active doesn't always mean staying upright. The most beneficial exercise is the one you can perform consistently without harm. Chapter 7. Recognizing warning signs, your body's wisdom. The messages. You shouldn't ignore your body communicates its limits through specific signals that deserve immediate attention and respect. Unusual shortness of breath, dizziness, pain that persists after activity ends, or extreme fatigue disproportionate to your effort level are all meaningful warnings that your current activity may be causing harm rather than promoting health. Pay special attention to new symptoms that appear during or shortly after walking. Joint swelling that wasn't present before, heart palpitations, or suddenly feeling unsteady on your feet. Marion, 84, noticed her ankles remained swollen hours after walking, prompting a medical visit that revealed early heart failure requiring treatment. By responding to her body's signals rather than dismissing them as normal aging, she addressed a serious condition before it progressed to a dangerous stage. Chapter 8. Personalized Approaches. Your Unique Journey. The Wisdom of Individual Solutions. The greatest insight for maintaining senior health isn't following general recommendations, but discovering the specific approach that honors your unique body, medical history, and personal circumstances. Working with healthcare providers to develop tailored activity plans acknowledges that your needs differ from others and may change over time as your health evolves. What serves you at 70 may differ from what benefits you at 85, and flexibility in adapting your routines demonstrates wisdom rather than weakness. Remember the profound words of Maya Angelou. My mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style. We invite you to share in the comments how you've adjusted your activities to match your changing needs. Your experience might provide exactly the guidance another viewer needs today. Conclusion. Moving forward wisely. The art of being wise is the art of knowing what to overlook. William James' true wisdom comes from knowing when to challenge yourself and when to protect yourself. For many seniors, less walking doesn't mean less living. It means living more mindfully and safely. By understanding your personal limitations and respecting your body's signals, you create space for joy, independence, and continued growth. We'd love to hear your experiences with adjusting physical activities to match your needs. Has modifying your walking routine or finding alternatives improved your quality of life? Share your wisdom in the comments below. Your insights could help another senior find their path to safer movement. Remember to subscribe to Golden Years Wisdom channel for more guidance on navigating life's later chapters with dignity, joy, and purpose. Until next time, Move wisely and live fully.